As we go through life, even if we have taken care of ourselves, the skin around our eyes stretches and wrinkles. Fatty deposits cause the upper lids to sag, while under the eye, the tissue can bulge forward and become discolored. In severe cases, vision can become partially blocked. Fortunately, through modern surgical techniques, Dr. Megan Silas is uniquely trained in the field of oculofacial plastic surgery and can help restore a more youthful, alert, and healthy look to your face and eyes.
I love ophthalmology. I think it's absolutely incredible to be able to treat patients and help restore one of their most valued senses, their vision. During residency, I chose to do some additional training in oculoplastics because I felt that it allowed me to do a variety of different types of surgery in addition to cataract surgery to help people, one, see better, but also to give them the confidence and create a more youthful appearance if that's what they're interested in.
This short video will explain several of the most common procedures Dr. Silas performs at the Williams Eye Institute, including blepharoplasty, ptosis repair, and Botox injections.
For upper eyelid surgery, the most common procedure is a blepharoplasty. This is where some extra skin on the eyelid is removed to help relieve that hooded appearance or that kind of droopy upper eyelids.
Blepharoplasty can be performed on both the upper and lower eyelids and is generally done using local anesthetic. When performed on the upper eyelids, Dr. Silas will remove the excess skin, muscle, and fatty tissue. The incisions are made along the natural folds in the skin so that as they heal, they will become difficult to see. When performed on the lower eyelids, Dr. Silas typically makes the incision inside or behind the eyelid. Or if there is excessive skin, an incision may also be made just below the base of the eyelashes. Bruising and swelling are common for a week to a month after the procedure. Cold compresses, as well as head elevation, will help reduce these side effects. Post-operative discomfort is usually relatively mild, and vision is relatively unaffected.
Ptosis is a problem with the eyelid muscle. The muscle that kind of opens the eye gets sometimes stretched out or loosened, and so the eyelids sit a little bit lower than they normally should. Sometimes just happens because people are born this way. Other times it can happen from trauma, rubbing, or other medical problems. Oftentimes, if ptosis is just age-related and kind of slowly progresses over time, it's usually very fixable with the surgery.
As ptosis progresses, it may interfere with vision. Surgery to repair ptosis can usually be performed via an eyelid crease incision or from the inside of the eyelid so there is no visible skin incision. For most ptosis patients, the procedure involves tightening the eyelid muscle, which is responsible for lifting the lid. After the surgery, your eyelids will be swollen and your vision will be mildly blurry. Keeping your head elevated and the use of cold compresses will help reduce the swelling. At night, it is especially important to keep the eye lubricated as the eyelids open as the muscles relax, potentially causing severe dry eyes. The speed of healing varies from patient to patient. Swelling and bruising will gradually improve in 1 to 3 weeks, and makeup can usually be applied to hide the bruising after 2 weeks.
I think that doing a cosmetic blepharoplasty and with a functional ptosis repair, if people have droopy eyelids that's obstructing their vision, is a really wonderful option for a lot of patients. It gives you that kind of revitalized look. You have more open eyes. It's just kind of a little bit of a cleanup to the eyelids. You still look like the same person, so we don't want to make you look different, but just like a kind of more awake, well-rested version. A common question I get from patients is what Botox can do for them and their eyelids and to restore a youthful appearance, but also help them with some functional needs. Botox is an amazing medication. It's placed into the muscle and it helps stop the muscle from squeezing. That helps to prevent wrinkles from forming or to decrease the depth of wrinkles, but it can also be used for people who have other conditions like blepharospasm or hemifacial spasm where their muscles are squeezing and that's out of their control.
Botox and similar medications are used to block the connection between nerves and muscles. When injected in small doses directly into specific facial muscles, it blocks the signals from the brain from reaching the muscle. As the muscle is blocked, the skin overlying the muscle relaxes, and the wrinkles caused by muscle contractions soften and often disappear. The areas most commonly treated with these injections include the forehead, the area between the eyebrows, and the crow's feet around the eyes. Other areas of the face may also be recommended for treatment after evaluation. With the use of a microneedle and extremely small amounts of liquid, any stinging sensation is minimal and subsides quickly. The number of injections depends on the amount of area being treated. Ice compresses and topical antiseptics may be used to minimize discomfort. Results are usually recognizable within a week, and your wrinkles should continue to become less noticeable over the course of the first month.
We do most eyelid surgery here in our surgery center at the Williams Eye Institute, and you receive some sedation either by mouth or through an IV to just make you calm and relaxed during the procedure. Once you're calm and relaxed, I numb up the eyelids so you don't feel anything during the procedure, and you just kind of lay there and chat, listen to some music.
In addition to upper and lower blepharoplasty, ptosis repair, and Botox injections, Dr. Silas also performs eyelid lesion removal, Chalazion excision, ectropion and entropion repair, treatment of misdirected eyelashes, evaluation of tearing, and eyelid skin cancer reconstruction. Since every individual is unique and has special needs, a personal consultation with Dr. Silas is the first step in determining if you are a candidate for any of these procedures. With expertise, compassion, and a keen eye for aesthetics, Dr. Silas is dedicated to creating a more youthful and healthy appearance for all her patients.
I think that the quality of care that the doctors here provide is outstanding, and I think that's truly incredible.